Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's hot outside. It is really, really hot outside. But we're here. I'm inside. It's cold. I mean, it's at least comfortable in this air-conditioned studio. I hope you're doing the same. You know, crank it up for a little bit of time or at least sip on something cold like a glass of water and some lemon. But you know what? Take it easy today. It's supposed to get up into the high 90s. Humidity is not good. And you're going to sweat a little bit. Anyway. We're here at 888-630-9625. That's 888-630-9625. Love to take your phone calls on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, you've done all the things that you can think of, and you've come up with, you know, as we've said before, same old, nothing. Nothing that's permanent, nothing that works, and that's why we do this program, to give you options to drugs and surgery. Dr. Tom Roselle Live has been on the air for decades now, and those of you who've listened know that we have a passion, and the passion's about you doing things the right way. Health is a do-it-yourself program. We have a topic today, one that is unfortunately far too pervasive in our society. It has the capacity to destroy your life, to stop the quality of your life, ultimately maybe shorten your life. It's one that we spend literally billions and billions of dollars on annually relative to treatment patterns, and they can stem from drug to surgery to just putting up with, and the cost to you, to your family, and everything else, because if you don't spend money, nobody else is going to spend it, and it's a downstream situation. What am I talking about? I'm talking about that pain that never goes away, that chronic pain. Whether it's back pain, joint pain, all over pain like fibromyalgia, whether it's headaches, it's there constantly. Your hands hurt, your feet hurt, something hurts, and it's day in and day out. It modulates, it goes up, it goes down, but it's always with you. It's that ghost that attaches to your back and just never lets go. In studio to help me talk about that and actually to talk to you about it, somebody who has an intimate look at this phenomena, and your host, your presenter this Wednesday evening, the 22nd of July at the Roselle Center for Healing, Dr. Scott Lamp. Hi, Scott.
Good afternoon, and hope everybody's drinking some water out there, because that's going to be one of the things that's going to be helpful for all this stuff we're talking about.
And you're going to go out and sweat and help your daughter.
Yeah, I certainly am.
Such a good dad you are.
Yeah, you bet.
I mean, you couldn't convince her to do it inside a gym, or you got to go out and really do that, right?
No, well, part of this is inside, part of it's outside, so it's a combination of both.
That's what I call chronic pain. And we won't go beyond that, but yeah, nevertheless. So seriously, all kidding aside, you're a good dad. I applaud you. That's, you know, and she's going to college too. Yeah,
that's the scary thing. So the stress mechanism is going high. So but she's doing good. She was a good student, so she's going to get some benefits from that for sure. So she's doing well.
But that's going to cause you chronic pain for the next 4 years anyway.
Well, we have more. We have more space.
That's the good of the bad. You know, I'm talking about that ching that you're going to have to put out now.
You see, I'm trying to stay on subject because it's a positive attitude.
Okay, we'll get back out of chronic pain. I thought we were talking about chronic pain.
Well, one pain is disappearing, and I'm trying to think of space. We got space. So.
Okay, Scott, let's talk a little bit about the thing that our patients worry about often. You know, as you know, we're chiropractors and acupuncturists and nutritionists in our practice, and we see this condition virtually every day of the week, multiple times a day by thousands of patients over a period of many years. And so we have a little intuitive sight to this thing that most people can't appreciate. But let's start with how pervasive is this? And, what are we really talking about? Is it we're talking about pain that people just, deal with, take an aspirin, call me in the morning, or what's this all about?
Well, first off, you look at numbers and stats. I think they talk, the last stat I looked at NIH, and it said 100 million people. That's a third of our country. And I probably would say it's probably half. The amounts of dollars we put to it, probably close to almost $1 trillion, maybe $750 billion to $1 trillion that's there. You add all the things that have these problems. It's pervasive across the board.
So in other words, if we fix this, we can fix the economy in this country.
Yeah, there you go.
That's an idea.
Yeah, it's a possibility.
You want to run for president?
No, I was going to ask you. You got a little bit more time.
No,
I see. I'm the young old guy. You're the old guy.
Okay. You're walking home, right? Okay, Scott, so listen, seriously. So we're talking about $1 trillion a year industry that is, one, destroying the country, but more importantly, destroying people.
Right.
So let's talk about what is really chronic pain. To get into that definition, what are we talking about?
Well, to make it simple, I think there's two things you got to take a look at. How do you experience pain? Well, you have to have a nerve that tells your brain, ouch. First off, just keep it simple. So something is affecting the nervous system and doing it chronically where the body kind of doesn't know how to reset itself. And the other aspect is the real big one is the inflammation that's associated with it, because that can actually chemically irritate a nerve until you do that. So we really got to look at those two kind of elements. How am I affecting the nervous system, and how is it affecting also inflammation in the body, which is in a lot of different ways.
So we got chemical, we got structural.
Yeah.
How about the emotional perception of pain?
And emotional also, because emotions, again, we talk about stress, we put out cortisol, which is anti-inflammatory. So if I'm stressed out and I don't have that capacity, now that's another factor. So I look at like inflammation from the outside in. The stress is from the inside out. It just doesn't have the ability to kind of fight it. You've got your cortisol levels go down so low you can't fight it. Your adrenals are shot, and all of a sudden now that becomes a problem because now that can't even control inflammation. So now you get third factor.
One of the things that I see on a day-to-day basis in the practice are guys that are coming in. They're putting up with pain, and it's been there for years, and they really don't have any way to modulate it. The docs put them on drugs, which often, for short term, they feel a little bit better as long as they take the medication, but the side effect is suppression of all the things we're talking about. Actually, a knee-jerk reaction, suppressing cortisol even further, but also with guys, testosterone goes down the tubes.
And I think one of the things, too, is like sometimes even if we take something even like antibiotics or something like that, it pushes things deeper into the system. And I think one of the big things with this is the compensations. The compensations we do structurally, the compensations we do chemically, and then the body gets reset. And the problem is trying to get a reset and get it balanced. And that's the key issue, I think, in all the treatment protocols we got to look at.
Well, let's talk about compensations, and I'm going to take them through one piece at a time because somebody gets hurt, right? I hurt my shoulder, I hurt my back, I hurt whatever it was, and then all of a sudden, they get a little treatment, and it seems to be better, and they're willing at that point because our society teaches us to do it this way, put up with. It's not that bad. It's okay. I really don't have any discomfort. They learn to live with it. What does that really mean? What does that compensation do to the body? Are they learning to live it? Has it gone away, or is there something else?
Well, I think it's what's the greater of two evils. And the body's trying to survive. I always think about things like a survival mode. If I want to try to hurt myself or hurt my knee, for example, and I'm slowly starting to heal, but I take some medications so I can deal with it and so on and so forth. The body likes to compensate, and it'll change neurologically. You got muscles that may be like an antagonist, like a muscle on the opposite side of what that muscle does. Give an example, bicep versus tricep, for example. And that muscle will get tight, and maybe even the fibers of the injured muscle might kind of change a little bit and adapt, but it doesn't want to hold the load, so it'll change its position. And as it does that, maybe it can convince the owner, us, that it doesn't feel so much, and it'll stick with that because it doesn't want to get the load. If that stays in that position for a while, you can get also inflammation or swelling to say, I don't want you to move that. And if it's a long period of time, you can also say a joint that feels unstable could also start building arthritic type problems.
Well,
bone spurs in there.
There's this thing called adaptive splinting as well. The body won't allow you to go into a pain pattern because it knows it hurts. It's ouch. Yeah. And it knows the cascade, and we're going to talk about COX inhibitors and that sort of thing, which is one of the biochemical pathways that medicine tries to control. But this Wednesday evening, Dr. Scott Lamp will be your presenter, your host at the Roselle Center for Healing in Fairfax. Love to have you as our guest for this class and any of the other in-house continuing education programs that we do on an every other week basis. If you have pain, you haven't been able to get rid of it, you've been putting up with it, you know that it doesn't hurt if I do this. Scott, that's a commentary I hear for so many people. Well, it doesn't hurt if I do this. Well, great, so you've given up your life, and so you don't do the things that you like to do. But 7:30 p.m., the 22nd of this month, a couple days from now, join us. Join Dr. Scott Lamp at the Roselle Center for Healing. All you need to do is call our office at 703-698-7117, 703-698-7117. Tell my staff you'd like to be there. These are our gift to you. It's our gift to the community. There's absolutely no charge because you have to be educated. We want you there. So call, reserve your seat because we only have space for so many people after that's done. And you're going to listen to a brilliant guy and perhaps maybe for once in your lifetime realize that you can get out of this mess. Scott, let's talk a little bit more about, this pattern that it begins to involve. We talked about joint space splinting.
Yeah.
We talked about how does the body, let's talk about an injury pattern. You have a car accident or you fall, you hit your head on something.
Right.
The body goes into an immediate reaction, okay, from pain, from inflammation to protection and so forth.
Right.
Let's talk about that.
Well, what happens is if you go like a whiplash injury and you're going to have a splinting of the muscles are going to pull down, lock it, doesn't want to move, tries to keep your body from moving it so the body can put inflammation to that area. And there's times that inflammation is important. That's why we do have inflammation in our bodies. And that starts your building process. Some of those things need to be there. It doesn't want your body to move. But the problem is that if we don't relieve that over a period of time, sometimes, like I said, the shunting happens and it doesn't relieve the pressure from it. The nerve position's not changed. The joints, and we think about the chiropractic aspect of the joints being irritated, that nerve keeps on being irritated, makes the muscle kind of get tight, and it kind of revolves around. It keeps on going. It's a negative feedback loop, and it's always constantly there. And if we don't break that cycle, then the body's going to adapt to that, and then start to move on to someplace else.
So it just says, I don't want to hurt anymore.
I don't want to hurt.
So it stops.
Yeah. So if we can find where that mechanism is and hit all the mechanisms that are, and there's a lot of things, there's these pain receptors, and looking where they are, and there are tons of pain receptors throughout the body. There's some in your vascular tissue. There's the ones in the muscles and the tendons and the fascial areas and all those kind of things. They have to be communicating correctly. And the thing is getting those to reset and then making sure that the body can take the load at that point again and find that particular spot and take that compensation out, and you can get some really wonderful results.
So now we're in this aspect. We're talking about a structural triggering mechanism is something that happened through injury, but injury can be subtle. It doesn't have to be a car accident.
Right,
it can be you lifted something, you're out of shape.
Ankle, yeah.
The body says, I can't do this anymore, so now you adapt, you push away from it. You have one knee that's breaking down, but you wonder why the other side is hurting.
Can I give you an example? And this is something that's I just went to a seminar out in Utah, and they were talking about Peekaboo Street. It was an skier, mogul skier,
right.
Olympic gold.
Yep, absolutely.
She tore up her knee. What happened is they went through the physical therapy, they went through all the aspects on it, and had her go through through whatever workloads to see if she can withstand the pressures in the knee, and she was fine. Goes to this particular gentleman and he finds out if he does a one-legged squat in a certain angle that loads that weak spot, she collapsed on the floor.
Oh, very quickly.
Very quickly. So she's like, how can I go down moguls if I've got that going on? So that's the thing we're talking about is you've got a subtle change, even on a superior athlete, because you got splinting of other muscles that were pretty extraordinary shape. But all of a sudden, being put into this other position, and all of a sudden you load it up, and she goes weak as a newborn baby.
We have a patient that just went through surgery for hip replacement at one area, and she, the surgery for the hip was because mechanically she didn't have function or motion.
Right.
She had a little bit of pain, but not a lot. The pain, significant, probably 7 out of 10 as on a day-to-day basis, constant, didn't go away. It was the other side. And it's that adaptation. She was pushing everything that side, no balance, couldn't handle it anymore. And, I told her, I said, you're not breaking the other hip down. You will eventually. I said, but what's taking place is you're compensating. She goes to the doc, and he says, yeah, absolutely. He said, 6 months, he said, your pain on the other side without doing anything is going to be gone. But that's the kind of thing that we're dealing with. 888-630-9625. That's 888-630-9625. That's how you find us here in studio. How you attend Dr. Scott Lamp's presentation this Wednesday evening is call our office, 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend and make that reservation. They will ask you for a confirmation number and the best time to call you back to make sure that you will attend so we can have other people be there. But we're talking about chronic pain today. It's not something that you need to put up with. It's actually something that you can modify. The sooner the better. We're talking about a multi-trillion-dollar industry in direct and indirect costs. Dr. Scott said probably more than 500 or 50% of the population, which is over 150 million people, just times that by about $10,000 to $20,000 per person and see what the kind of numbers you come up with. And those are the direct costs affecting you. We'll be right back after some important messages. You've been everywhere, you've done everything, and you still feel like, well, Did you know that your health and wellness starts with your brain and nervous system? What if by establishing normal brain and nervous system function, you could regain your energy, strength, and vitality? Would you be interested? I'm Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me and an elite group of wellness practitioners for Ageless Health 2015 on October 17th at Fairview Park Marriott Hotel in Falls Church, Virginia, for a day that could change your life forever. A day when you'll learn step by step how to create a brain-body connection that will allow you to live in a state of wellness that you deserve. Register today at agelesshealth2015.com. That's agelesshealth2015.com. Or call 703-698-7117. Register today. After all, your health is a do-it-yourself program. Welcome back, everybody. Dr. Tom Roselle here. Call us, 888-630-9625, 888-630-9625. Dr. Scott Lamp in studio. We're talking about chronic pain patterns, those things you've been putting up with for way too long, and it's destroying your life, and you're having to take all kinds of things just to be able to cope, be able to deal with a day-to-day basis, but it takes away your life and everything that you'd like to do about it. Here's an opportunity. This Wednesday evening, 7:30 p.m., the 22nd of July, Dr. Scott Lamp will be talking to you about this subject and being able to turn the situation around, if you will, and actually put you in a place where you don't have to put up with this. Your body is proactive. As long, my old axiom, as long as you're breathing, you can repair. As long as you're listening to me, your body will begin to change things. I don't care where you are in the state of life, no matter how significant, you always can make a difference. 888-630-9625. Call us 703-698-7117. Tell my staff you'd like to be there this Wednesday evening. Colette, thank you for holding and being patient. How can we help you?
I have pain. It started 10 days ago regarding my legs, both legs in the back, starting from the hip all the way down. I'm not able to get up the steps.
Have you had pain before?
No.
Okay, so this is just kind of out of the blue and not before. Front, back, or all through the leg?
Yes, all the way to the legs, from the back hip down the legs.
Have you done anything? Were you lifting anything? Did you?
No, I was doing the elliptics.
The elliptical?
Yeah.
Okay. Go ahead, Scott.
Colette, how young are you?
70.
Okay. And do you do any exercise at all, anything like that?
Well, that's what I do, the stretching. The last time I did elliptical in one of the beaches here. It's for 20 minutes. That's the most that I did. After that, I'm feeling good, but after I came home.
Colette, do you drink a lot of water, or do you forget about water?
No, I drink water. Sometimes I forget, but not.
For how much water do you drink during the day?
4 or 5. Okay,
you're not even close. You need to be at least to double that, and particularly in the weather that it's hot like this. So what happens, and this is just, Dr. Scott will ask you a couple of things, when you're dehydrated, when you're not getting enough water in your body, then the tissue becomes very tight and it's susceptible to tearing. You end up with scarring and adhesion and so forth. So when you do something like you did, the stretching and so forth, something that should be beneficial to you now can become detrimental to you. and you end up hurting yourself and putting yourself a place where the nerves in the low back that go into your leg now are going to be screaming because now they're inflamed because the tissue around them are inflamed.
Yeah, the other thing too is like the joint spaces. A lot of times if you do like a thing like the elliptical and you're done, and a couple hours later swelling starts to happen, a lot of times that could be also in the joint space that happens. So as Tom was talking, there's the soft tissue and then there's the harder tissue of the joint. And again, a lot of the cartilage needs water. So, and the other thing too, not as just the aspect of 4 or 5 glasses you've taken, but do you drink coffee? Do you drink teas? Do you drink any sodas?
No, I drink tea sometimes, but not coffee.
Just remember that caffeine can dehydrate you too. So for everything that you take caffeine-wise, you have to put water in there also. So there's a multitude of different things that might be going on with you. And as Tom was alluding to, again, the tissues being tight. Also, when you went on the elliptical, how often do you go on the elliptical, or is this something that you just had a chance to get on a machine and do it?
This is the only time, 15 days ago, I did the 20-minute elliptic, but usually I do 4 or 5 minutes, sometimes 10 the most.
Every day?
Home.
You do it every day?
I'm not doing it now because I'm afraid to do it.
No, but before you got hurt?
Yeah.
Okay. So your body was at least adapted to that, but the other piece, I think there's some predisposition there.
Yeah, and I think the other thing, too, if you're only doing 4 to 5 minutes and then you go up to 20 minutes, it's also, there's a thing in athletic injuries they talk about, the fact it's too much, too quick. To give you a reaction to, I remember having a kid came in, one of the first kids I saw when I first started practice, and he never played tennis before, and he decided to do 5 hours worth of tennis 5 days a week. He came in with shin splints. Yeah, and you never see shin splints on tennis players generally, but he did because it was too much too soon.
Yeah. So here, Colette, listen, I want you to do this. I want you to start today. I want you to start drinking a glass of water, just 8 ounces of water every hour. You don't have to throw it down. Just sip, 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 sip. But I want you to I want you to be able to consume 8 ounces of water every hour for up to 10 hours. And then at least 3 or 4 times during the day when you're drinking the water, I want you to get a little bit of sea salt, not regular salt, but sea salt, and put a little pinch of sea salt in the water. And then get some magnesium. In your particular situation, magnesium glycinate or magnesium citrate would probably work. Take about 200 milligrams twice a day. None of this will hurt you in any way. It's not going to affect anything that you're taking. And in 72 hours, it should start getting better. If you keep the water up, then stretching, gentle stretching will help you. But if it doesn't, if it still persists, doesn't go away, then Colette, give us a call. Appreciate your phone call. We're coming up to a break, and we're going to start talking and getting more into depth on chronic pain patterns, the things that we put up with. This is a situation where this young lady, if she doesn't be careful, she's going to suffer with chronic pain for a long period of time. So hope she'll do it. We'll be right back. Don't go away.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. We're listening to Dr. Tom Roselle Live, 888-630-9625. That's 888-630-9625. That's how you talk to us here at the program. We're talking about chronic pain this Wednesday evening, July the 22nd, 7:30 p.m. at the Roselle Center for Healing. My guest in studio, your host this Wednesday night, Dr. Scott Lamp, will be presenting this program. So for those of you who've been suffering forever, and we know that over 50% of the U.S. population is suffering with some sort of chronic pain that just doesn't go away, this is an opportunity for you to figure out what to do with it. So whether you've got body pain all over the place, whether you have this, even pain, Dr. Scott, of that bug-like crawling feeling all over the place that drives people crazy. It's all over their body. That's a pain pattern. That's affecting the nervous system. Mm-hmm. You have those kind of things. You just ache. People who are on statin medications, their body aches. They hurt, and they don't know why they're hurting like this. And then one drug after the other. And we're getting to a situation right now where, so many physicians say, well, it's all in your head. And they start writing prescriptions, and we know that, we're talking about big business. We're talking about 250 million prescriptions of antidepressants, antipsychotics are given every year in this country.
Cholesterol medications, antibiotics, it's just huge.
Yeah, do the math. I mean, you multiply this stuff by like $40, $30, and you can see what it comes out to. It's awful. And you are the laboratory rat that unfortunately, Xanaflex is another common drug that they're using for this type of thing, but it has a tremendous side effect on the liver. And it'll shut it down, and you lose your life because of some of these things. Find out what you can do. This is an opportunity this Wednesday evening. 630-9625. Call us here, but more importantly, attend this Wednesday evening, 703-698-7117, and find out from an expert in pain patterns what can be done to eliminate this without drugs, get you off of some of the stuff. So whether you call it myofascial pain, fibromyalgia, restless leg syndrome, crawling feeling, my head hurts, it's pounding, my big toes throbbing all the time, I don't know why. This is an opportunity for you to really find out what the deal is. And some of this is so easily corrected, it'd make your head crazy. Bernice. Hi, hon. How you doing?
Oh, fine.
What's up? What can I do for you?
I wanted to know, what are the vitamins and nutrients that we need to grow our cartilage in our knees? And what's the dosages?
I can't give you dosages because I'll give you general broad brush, Bernice, because here's the deal. When a cartilage is gone in a weight-dependent joint space, the chances of getting it back, is it possible? Yes. Is it likely? Not so much, even from my business. Now, if somebody has where you start with this is you take a look at the patient, and if they've got too much weight, they got to get it off, because every pound that you have in your belly is 4 pounds in the joint space below it, whether it's a hip or whether it's in the knee. Secondly, you have to look at the diet. Inflammatory levels are acidic. So if your diet is, replete with sugar, sodas, coffee, fast foods, fried foods, alcohol, gluten, additives, preservatives, my mantra, then you have an acid body. As a matter of fact, while I'm on that subject, Dr. Scott, this Wednesday evening, I know that you're going to talk about how acidity has to be eliminated before anybody can ever get rid of the pain pattern. And you're going to do something there, too. What?
Yeah, we're going to do a pH paper litmus test on people coming in. We'll do an oral check, and that'll be actually part of our thing. We'll do that for free for people coming to our talk, and just to see how acidic you are. Now, I would like you to think about this when you come into the talk, though. Make sure you haven't eaten anything the last hour, so it gets a little bit better type of testing aspect. Sometimes if you're drinking a lot of coffee and you show up, that might kind of skew results a little bit. Yeah. So if you can keep away from something, water's okay, but like coffee and things like that, try to stay away from it before you come to the meeting.
And it'll have a much better test. But Bernice, drink water, tons of water for this type of thing. That's where you start with things. Weight, water, high levels of vitamin C, ascorbic acid. Get a natural form of vitamin C, 1,000 milligrams at least 3 times a day. Vitamin C is the primary component in cartilaginous tissue to repair. There's things like MSM, and there's glucosamine sulfate and glucosamine, combinations and so forth that will make a difference. But you have to prepare the internal body first. You have to make sure that the gut is working, decrease the inflammation, get the garbage foods out. Then now you have something that your body can work with, but that's where it starts. I'd have to know a whole lot more about the specific patient.
Yeah, I mean, Bernice, like 80% or 80 to 90% of your immune system's in your gut. And again, you could be taking things that can go right through, so you have to take a look at your gut history. Glucosamine, as Tom was talking about, actually does very, very well in combination with some of the fish oils that are out there. So when you combine it with both, it actually does better. So there's a lot of different things you got to take a look at, but first off, do I simulate and get it in? And then the other thing, what we talked about before, was compensation. Why'd you have the knee problem in the first place?
And then you want to decrease the inflammatory reactions. And I'm getting ahead of the mark here, but there are things like Boswellia and Bacopa, and that will decrease inflammatory reactions. The dosage is different for different people. It depends on the other parameters that we just talked about. So anyway, Bernice, honey, I hope that helps. I appreciate the call. Again, it's not a straightforward situation. Mike, thank you for calling. How can we help you?
Yes, I'm retired. I'm 62 years old, and I'm very active. I play golf, tennis, ice hockey, and all those movements. I'm right-handed, and all those movements, my side, I get pain in my side, and it's been constant on and off for about 6 years.
Yep.
And I've heard you talk to a previous caller, and it's you probably answered my question already. But one of the things that I find really hard, I've never stretched throughout my life, and I've always been athletic, and I find it so hard to stretch because I'm so tight.
Yeah, it's a feedback loop. The less you stretch, the tighter you get. The less you want to stretch.
Yeah.
So let me ask you another question. Do you do any kind of core training type of exercise?
No. Okay,
so that's anytime you play a one-sided sport, golf, tennis, racquetball, if you're prominent with one side, if you did play handball, I'm one of these old guys that used to love to play handball. If you don't strengthen your whole body, guaranteed, predictable, you're in trouble, you're going to get hurt. So you have to do the rest of the stuff.
Yeah, and there's some things, too, in sports, too, what they do in the professional, at least in professional golf, too. You'll see people, what they'll do is every time they strike the ball, they're a right-handed golfer, every time they strike the ball and put the energy into the ball, they'll come back and swing in the other direction. So you got to look at balance is one of those things, too. So you're doing a right-handed sports, especially like hitting, it's good to swing in the other direction to balance that up, or you can start building scar tissue, and the body will start going into that position. The things that Tom talked about, and also there's things like also the core, along with dynamic stretching, not static stretching, is very important because it warms up the tissue to get it more flexible.
When you go out and do anything, you should spend a short period of time just gently warming up. Then you stretch, and then you get into it. You never stretch cold muscle. And then after you're done, then you stretch again. But prior to that, the preparatory phase is you've got to get strong. You've got to get your whole body so it tightens up.
Yeah, and there's some other things, too, that I've kind of introduced in the office is the stick. It's one of those things that's actually a very quick thing that you can do. That's actually even also when you're in the office, you can actually kind of roll out your muscles. 3 things are really kind of elongate a muscle that's tight. It's going to be heat. That's going to be in it. Actually 4. You got to get the nerve actually functioning correctly so it's not tightening in the guarding aspect. But heat, stretching, and what's the other thing I'm thinking? Massage. That's the stick. So that would be the things that kind of work on getting things to open up that you can work on yourself.
Over a period of time, what happens, Mike, is you end up damaging joint spaces because you're only using certain muscle patterns. Think about it this way. I'll exaggerate the pattern. Put 10 pounds in your hand and start doing curls, right? So you're contracting the biceps. And that's all you ever do. You're just doing a curl because your job requires you to be able to pull towards you something in the neighborhood of 7-8 pounds, so you want to overstrengthen it. But what happens is your triceps, the back part of your arm, isn't getting any exercise. So now your arm is going to tighten. You're not going to be able to straighten it out. You're going to affect your elbow. You're going to affect your shoulder. You're going to affect the whole shoulder mechanism, and you're going to have other pain patterns, and you don't even know that you've maladapted it. So you have to strengthen, but you're going to end up causing problems as well.
So what Tom's talking about is compensation. So again, we're talking compensation. We started off the show with that type thing. Well, there's some things where you actually can measure athletes. There's things I'm currently doing now with young athletes and measuring. And one of the things that we're measuring from tightness and also for balance from side to side. And sometimes the imbalance from side to side can be just as bad or worse than the tightening. You want to be balanced. And if you're not balanced, then you're going to form compensations which will cause injuries later. So if you gave me somebody who is tight, and when you gave me somebody who's out of balance, sometimes some of the person out of balance could be more likelihood to have an injury.
So one of the things I do whenever I strike on the right side, people tell me you tense up. And I'm wondering how much that has to do with it also.
That makes a difference. That makes a difference too. I'm going to tell you a quick story, and then we've got to go on, Mike. I got to take some other calls. But here's I used to treat a lot of the women's LPGA when they used to come in town. A classmate of mine started referring people in to me, and this one woman, this goes back probably 15 years ago, she'd come into the office, and she was complaining that every time she got into a place where she was striking the ball, and she would slice it continually. And she was it was worse on the course when the stress was higher. And when I examined her, I checked her muscles, I checked her spine, I checked her structurally completely. I couldn't find anything. I said, "Could I come out and watch you?" So I went out and watched her on the course. And I stood behind her, and she had a bucket of balls, and all I had to do was watch her 3 times. And every time she came in to hit the ball on a drive, her jaws would lock down. Really? And as soon as she did that, she'd raise her shoulder, and the ball would slice. So I went up to her, and I took a tee. I put it between her lips. I said, "Don't bite this. Just hold it in between your lips, and make sure you don't bite it." And as long as she did that ball she hit it straight. So in that particular situation, she had a TMJ problem because she was a grinder, she was a clencher, and she had destroyed her TMJ, and because of that, neurological aberration took place. So all those things can make a difference. Anyway, Mike, appreciate your phone call. But this is the kind of thing that we see, and we see it all the time.
And I think it's constantly, and let's not take it as a sports aspect. Let's say you're sitting there, and I want you to, think about being on the mouse on your computer. And you're putting your arm out, and your arm, and I did this with you, Tom. I caught you the other day with it. Basically, he was holding his arm a little bit more forward in the front, like his hand was the mouse. The mouse was probably maybe 2 or 3 feet away, and his arm was actually going up in the air to some extent. I said, take the hand, rotate it like you're having a cup, you're actually a beverage or something at a party. Would you walk around with your arm like that? And he said, no. And then basically bring the arm to your side, and it feels better. So we're doing it just the innocent things of doing computer work. This is called accumulated micro-trauma that we don't realize it's there. It can go on for 10, 15 years, and all of a sudden now I got this pain and I can't get rid of it.
And then you adapt and you do other things, and that breaks things down. And, listen, this Wednesday evening, you're going to find strategies. You're going to learn how to get rid of some of the pain patterns. You're going to catch yourself in ineloquent situations. Give our office a call at 703-698-7117. And tell my staff that you'd like to attend. That's 703-698-7117. Amanda, thank you for being patient. How can we help you?
Well, I would be grateful if you could talk about pain in the hand. I have fairly severe pain at the base of my thumb. Keeps me from doing many things, and I'm doing glucosamine and chondroitin, and
so it hurts.
Chiropractor works with it as well.
Okay, it hurts when you use it, right?
Yeah.
Okay, so the first thing that you got to find out is you're taking things that help restore joint space but not necessarily decrease inflammatory reaction. But you got to take it a step before that and say what caused it to begin with. Mm-hmm. So you've got to check when anything affects the thumb, the nerve root that comes to the thumb is the fifth nerve in your neck. And so you take it up where the areas that can be trapped. You look in the wrist, you look in the elbow, you look in the shoulder, and then you look in the neck. And it may be all of those things, or it may be a muscle reactive response, meaning one muscle not strong enough and the other one is overcompensating. And that can happen. Your thenar pad, we're talking about, the base of your thumb, is being affected here. So you have to look at the wrists. You have to look at all the muscle patterns. You have two bones in the lower portion of your arm. And if they're not aligned properly, you've got an issue.
One of the things also, Amanda, too, is that this is one of the most arthritic places of the body, only because of the fact that how you use it and how you take it. If the thumb's away from the body, like using your space bar on your keyboard, there's a tendency for the body to kind of overuse it, and it's got a lot of moving parts, but it's not as stable as the three middle fingers. So there's a tendency to how your technique is and when you're doing certain things. But Tom's also talking about inflammation. You got to talk about tenosynovitis, which is another one that could be a possibly differential diagnosis in
Correct.
here. So there's a lot of different things you could work on with that. And again, you got to look at the whole system. And again, if you're taking supplements, how's your digestion?
And here's another little piece, just to complicate the issue even more. Acupuncture channels flow throughout the entire body, and they're interconnected. The one that ends on your thumb is the acupuncture channel for the lung. So anything that is going to presuppose the lung to irritation is going to manifest itself along the channel, along that track, and could be affecting that thumb as well. So you have to look at structure, you have to look at the energetics, and then you have to ask the question, was there an inflammatory reaction, a biochemical reaction, was there a trauma, injury, combination of all those things? Are you compensating, are you putting up? And, this Wednesday night is your opportunity to find all of those things out, and you call us at 703-698-7117, 703-698-7117. Tell my staff you'd like to be there. We'll be right back after some important messages. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You listen to Dr. Tom Roselle live, as you do every Sunday, 12 o'clock, right on the dial where you're listening right now. We'd love to entertain you. We love to educate you. We want to make sure that your health is a priority. We're here to educate, serve, and empower you on your path to extraordinary health, and that's why we've been doing this for decades. But, the bottom line is that you are in control. Health is a do-it-yourself program, and you must educate yourself. You must learn the nuances. Never take anybody's word for anything, even mine. Our job is to provoke you. Our job is to stir the pot and to make sure that you understand that you do have options. This Wednesday evening, Dr. Scott Lamp will be your host, your presenter at the Roselle Center for Healing. The 22nd of July, 7:30 p.m. Join us. If you got any kind of pain in your body that doesn't seem to want to go away and you're having to put up with it, you're taking medications from psychogenics to painkillers to COX-2 inhibitors to anti-inflammatories, that's not okay. And the side effects are ridiculous. And some of the meds you're taking for other things are causing the pain. Call us, join us. Let's see if we can make a difference in your life. It is one of those things that if we could fix this one problem, we would truly, truly be able to go a long way into fixing the national debt, because we're talking about trillions of dollars that are spent every year directly and somewhat indirectly, but we're talking about a manifestation, a snowball effect that just doesn't go away. Karen, you have been extremely patient. How can I help you?
My daughter lives in Philadelphia, and she's going to the doctor this week to be tested for Lyme disease.
Okay.
She thinks she has Lyme disease.
All right.
And she's kind of been ailing since the end of June. And
why does she think she has Lyme's?
Well, first of all, she came by at the end, I guess it was around July 4th weekend, on the way back from the Outer Banks, and she was going to spend the night. And she had a fever, and, so I took her to the Minute Clinic the next day, and they said that they thought she was recovering from the flu, although she didn't test positive. But she has fever, severe aches, eye pain, constipation, no sinus, no cough, no sore throat.
That could be anything.
And she has insomnia. Yeah, I know.
I mean, it can be anything.
But she reads all this on the Internet.
Of course. That's the problem. The good news and the bad news of the Internet is that it can give you a lot of information. The bad news, it gives you a lot of information without you having necessarily the background to interpret the information.
Yes.
But that's why it's an ongoing study process. So let me give you a quick thought, because we're coming up to the end of the program.
Okay.
Lyme's has many manifestations. In the acute situation, you're going to see some sort of bullseye, sometimes very small, sometimes very big. It can look like a wide spreading rash. There can be a fever, and there may not be a fever. It can be just pain. Sometimes the clinical symptoms don't manifest for weeks, and then it's a slow, subtle situation. It can affect the body with pain. It can affect the body with mental problems and neurological systems, immune suppression, and so forth. The list goes on. So what I would encourage you to do, I'm not going to, until we know definitive, Lyme's would be a program that we could spend 4 programs on. But here's the situation. It can cause pain. It can cause all the things but we don't know. We don't have enough information. She has to have a broad-based examination, blood work examination. Well, they're probably going to do a very limited test. If it comes back negative and she still has a problem, send me a note and I will give you the metabolic test that she should have done, and I'll tell you who's in that area that can assist you in finding that out. So keep me posted. All you got to do is go to drtomroselle.com, drtomroselle.com. Karen, thanks. Good luck. Let me know what's going on. Scott, wrap it up for us. Tell us what we've got to look forward to Wednesday evening.
Well, we're going to go over a lot of the different aspects of where pain comes from. There's things that are what they call nociceptors. There are pain receptors. They'll actually talk about some type of visceral pain or somatic, which actually is muscular pain. We'll talk about things like sympathetic pain, like RSD, that kind of thing, reflex sympathetic dystrophy, and some other neurological pains that I have there. We'll have you dietary aspects, anti-inflammatory diets. We have the litmus paper test, the pH, a bundle of stuff.
It's going to be a busy night.
Yes, it is.
If you really want to find out how to get rid of this and not limp along anymore and see what your options are, this is an opportunity for you. Call our office, 703-698-7117. We tried to make sure that you have options, that you have capacity, that you can do things that you haven't thought about. That's why we do what we do. That's why we do this program. See you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.